My name is Dr. Tracy Casas. I am a nurse practitioner by trade. So I was a registered nurse for about eight years, and then I became a nurse practitioner. I've been doing that for also about 7-8 years, and then just recently graduated with my doctorate in executive health systems leadership. So I have a unique role in the sense that, from an organizational and strategic planning standpoint, I understand that portion of it, as well as from a clinical standpoint and operationally, the benefits of the Zephyr hoverboard. And so kind of that's where my presentation is going to lead today. I am a user myself, and my attending Dr. John David, which is here in this picture with me. We use the Zephyr hoverboard in our practice every day. Thank you, Tammy. So why is the Zephyr HDR hoverboard a must-have for brachytherapy? There's seamless patient transfer, reproducibility, you can rely on, and fewer staff required. So this picture right here is a patient of ours. Just a little bit of a side note, I work in a outpatient facility, and we do anesthesia cases in office. We do in-office anesthesia for prostate and gyne brachytherapy. We also utilize it for patients that are awake and conscious as well. So you can use it for in an anesthesia setting, and also a setting where patients are alert and oriented as well. So from a clinical standpoint, as you can see here, this is a patient that's under anesthesia. And it is a great feature that as Tammy mentioned, the safety strap is great. Obviously, anyone that works in an OR setting, you can see that that's a must. So the safety strap is fantastic, as well as the side rails. They are down in this picture because our doorways are very narrow, and we have a tight fit. But as we wake up patients, and as they're coming out of anesthesia, those side rails are a must for me. Because as patients are coming to, they become a little bit sometimes agitated or confused, and they're grabbing and moving. So the side rails we always have up, obviously, when we're outside of transferring patients as well. And then also from a staffing standpoint, it works out phenomenal for us because we are an outpatient setting. We don't necessarily have the number of staff that an inpatient hospital has. And even when you're in an inpatient setting, you're very busy. So I personally like this equipment very much because I can operate it myself. So if there's a patient that is awake, I can transfer them myself or another staff member. So instead of in a time where, even consider a patient that's, upwards of 200, 300, 400 pounds, it only takes one person to transfer the patient versus a setting where it takes 3, 4 staff members to transfer a patient. So from a staffing standpoint, I really love this product because it minimizes the staff, and also ergonomically, it is phenomenal on your back. Like I said, someone that was a bedside nurse in their early 20s that was shifting and moving patients around and constantly going to the chiropractor massages because my back was constantly being kind of brutally manipulated. This is phenomenal ergonomically as well because it's not only comfortable for the patient, it's comfortable for staff as well, and prevents any sort of injuries at work. And then I kind of briefly touched on this as well, for enhancing safety, efficiency, and outcomes. Why does the Zephyr hoverboard matter? As we mentioned, improved airway and patient safety. Our patients under anesthesia, they do not require intubation or advanced airways. As you can see, this is a patient that we have under anesthesia that's receiving prostate brachytherapy. And they typically were able to safely position them and treat them and have them maintain their own airway, whether it's nasal cannula or a non-rebreather mask. And then efficiency as well. We've kind of touched on this. There's fewer staff and also the true immobilization. So from a reproducibility standpoint and from dosimetry standpoint, you're able to, each additional fraction, the patients are in the same exact position. And with devices such as the universal clamp bracket, you are able to safely secure these devices to the point that, there's not even, the tiniest adjustments that you have to make. I always say in brachytherapy and this specialty, millimeters matters. And there's been no issues with movement of devices at all, even to the millimeter standpoint in our clinic since we've integrated this product. And so as far as what we've observed so far, and this is as of last month, we've had 3 times increase in workflow efficiency and improved patient comfort. Reproducibility, dosimetric results within less than 5% of intended dose, as I was just mentioning, with millimeters mattering and treatment planning. And there's been precise needle placement maintained less than 1 millimeter of the target position. So not only is it great from a patient comfort standpoint, from a staff efficiency standpoint, as you can see in this picture, this is me moving this patient by myself. I'm only 5'2". I probably shouldn't say my weight on a public forum, but I'm a rather smaller woman, and I can seamlessly move these patients by myself. So from a staff standpoint, it works out great for us. And then also, as you can see on this slide, from a physics and dosimetry standpoint, the dosing and the reproducibility is phenomenal.